So many people talk about it, they suffer from it, and don't know exactly what's happening there. Chronic pain. If you're a pain sufferer, do you know what's happening and why it's getting chronic? Here come some facts that are important to know, so stick with me. Hi, this is Gideon from Step Into Life Despite Pain Together. I'm a psychotherapist specialized in the treatment of pain patients for way over 20 years now, and I'm a pain patient myself. So I know the story from both sides. If you like our videos and you want to know more, just hit subscribe down here and you'll be informed for every new video that comes out. We all know what pain is, right? It's that uncomfy sensation that goes from feeling a little uneasy up to the extreme heights where you just want to lay down and scream. And everything else in between is possible. And because of a slight uneasiness, you're not here, right? Thought so. So let's dig deeper. The actual definition of chronic pain is really simple. Let's look what I found at the homepage of the Johns Hopkins University. Chronic pain is a long-standing pain that persists beyond the usual recovery period or occurs along with a chronic health condition such as arthritis. It doesn't say which kind of pain you have to experience to have chronic pain. This might be everything from back pain to over migraine to fibromyalgia. It is just defined as existing longer than the usual recovery period of 3 to 6 months. Again, 3 to 6 months. If you have this kind of long-standing pain that lasts longer than this period, we start to speak about chronic pain. Of course, it could be recurring pain, like a migraine that shows up more often, like once a week. Okay, I see. That's not really overwhelming information, is it? So why is it so hard to treat the pain? Let's start out with talking about different kinds of pain. This is really important to know. So let me give you a short crash course about these kinds of pain. The first two you might have heard before, but the third one is based on really new research. And I think it's especially interesting for chronic pain patients. First, I want to talk about nociceptive pain. This is the normal pain that everyone experiences when you hit your little toe on your couch, when you break a bone, when your stomach aches. This is normal pain. And it's based on fibers that are all throughout the body, in every corner of your body. And they constantly check if everything is all right. And if they detect something wrong, they tell up the brain. Yes, all they do is checking for damage. If there's a damage, the brain might decide to set off an alarm for it. Now, what happens if the pain goes from acute to chronic? First, you gotta know that the pain is not the body sensation alone, because what always shows up are thoughts and feelings along with the body sensation. The stress system in our brains is always triggered when there's pain. This is because it's not the right time to dwell into romantic and nice thoughts and feelings when you're in danger. Did you ever experience that your brain set off the stress system and you tensed up when the pain came along? Let me know in the comments. All the emotions like anxiety, fear, frustration, depression, and so on, they're all linked to the stress system. Have you ever seen someone in real pain who's totally relaxed? Not me. Something interesting happens when you experience stress over a long time. Your cortisol levels in your body rise and changes in the immune system occur. And by this, our nociceptive fibers, you remember those fibers everywhere in the body? They become more and more sensible. So smaller triggers can already make them go wild over time. Have you ever wondered why you became more and more sensitive to things that didn't set off the pain before? Okay, let's get to the next kind of pain, neuropathic pain. This one is really simple to explain, but quite nasty to experience. It's all about nerve damage. When nerves are damaged, they, who would have thought, give quite bad signals. If you have this neuropathic pain, it's often described as a burning or like ants on the skin, or it feels numb, or sometimes it shoots in like an electrical shock. The nerves that are damaged, they don't function like they should anymore. And actually there are a multitude of possibilities why a nerve can be damaged. It can be an accident, it can be by a disease, it can be by alcohol consumption, or as a follow-up of a diabetes. High sugar levels for a long time and high alcohol levels over a long time, they just damage the nerves. If you suffer from this, it's really important to get a grip on that. One word most people probably know is that if a lot of nerves are damaged, it's called polyneuropathic pain. Polyneuropathic pain. And actually that's a pretty common disease. Nociceptive pain. And now it's getting really interesting because we now dive into new science. We always think that the pain is there where it hurts in the body. Maybe my elbow, maybe my shoulder, maybe my head, wherever. But actually, pain is decided by the brain. And this is what we know from all the neuroscience of the last years. We know that our brain decides to set off the alarm. So everywhere else, it's incoming information about something's happening here. But if it's dangerous and really needs an alarm, like pain, it's decided by your brain and your brain alone. Isn't that interesting? Nociceptive pain or neuroplastic pain, you can use both words for it, they're not very well understood, not like the other two kinds of pain we talked about before. But what we know is that it's linked strongly to our fear-stress system. Both of them use some of the same parts in our brains, and both are alarm systems that are designed to keep us alive. So when you experience high levels of anxiety, stress, fear, pressure, depression over a longer time, your brain might decide to set off the next alarm system, and suddenly there's pain. And this is a pain that no doctor can find somewhere in your bones, somewhere in your muscles, or wherever, because it's solely created by your brain. Typical kinds of nociceptive pain are fibromyalgia, certain kinds of back pain, tension-type headache, or something with these strange symptoms like CRPS, complex regional pain syndrome, formerly known as morbus Sudeck. Now, how does the pain eventually become chronic? First, you have to know how our nerve cells communicate, because it's all directed by the nerve cells in our brain. Consists of millions and millions of them. So if I take my arm as a nerve cell, it's like electricity goes along the nerve cell, and in the end, if there's enough electricity, the nerve cell releases neurotransmitters. The other nerve cell, on the other hand, takes them up. There's an electrical charge that builds up, and it goes along. That's how our nerves constantly, all the time, communicate with each other. Now, if they communicate very often like that, they become more efficient in it. They become better in it. And they become faster, and sometimes they even start to grow so they can communicate better. This is what we call learning. And learning we like very much if it's vocabulary, it's how to repair your car, maybe it's playing tennis or whatever, playing the piano. Our brains are big learning machines. They learn everything they experience. And the more often they experience it, the better they learn it. Now, talking about pain, here's something crooked, isn't it? It's like our brains, they start to learn pain. And they learn it very well because it's presented to them more and more often. They produce it, they set off the alarm system, and the more often they do so, the better the pain is learned. And this is what we call the pain memory. The pain memory is so efficient because pain signals are so important, because it's about our survival. And what is more important than our survival? Even if it's in situations where we don't have to survive, but our brain tells us so. So when the brain learns, it always learns best with strong emotions or connected to danger signals. And this is exactly what we have here. Our brain thinks more and more often something's wrong in the body, there has to be something, and gives us the signal. And everything that's linked to it gets learned especially well. Now something really strange happens, because everything that's learned along with the pain, like certain activities, certain emotions, maybe even certain thoughts, they can set off the pain. I just had a client in my office, and she told me about her back pain that is really, really bad. She was actually doing bowling professionally. Didn't know up to then that this was possible, but here in Germany, obviously, you can do bowling professionally. She was out of training for a long, long time because of her back. And she told me that last night she just thought about going back to training, and actually there was a sense of joy in her, and suddenly her back started to ache. Without her even moving, she sat on the couch. And this is how far the pain memory can take you. Now, it sounds all like bad news, but actually it isn't, because that's the part where we can get our foot in the door and we can try to change something. We're not very good in decreasing the pain, but we're pretty good in dealing with stress and anxiety. And because they're so close together, we can influence them. And that's part of what a pain psychologist does. So if you're interested in more information, just subscribe to the channel and you won't miss any new video. And I'm happy to take a step into life with you.